Hey guys, Luis Moreno here, Simply Health Insurance Agency, and I am doing an interview with Kim Rich. We're going to be addressing a common question that we get from agents when they're dealing with insureds about the out-of-pocket, and more specifically on that out-of-pocket, they seem to be telling a lot of agents, I don't care about it. They'll just write it off. They won't ask me for it. And Kim, give us a little bit of your background with hospital debt settlement.
So I had the opportunity, and hi everybody, to work with debt settlement in general, and it is a epidemic in this country, debt, and a lot of what we dealt with was medical debt. So, and I would just say that medical debt is, I was just telling Luis, it's relative. So what, $1,000 or $5,000 for one person to them is overwhelming. And another person, it's 50,000. We dealt with clients over $100,000, $200,000 worth of debt, like crazy amounts of money. But basically what happens is clients rack up bills in the hospital. So they get the deductibles, they get the bill at the end of their procedure or their stay or whatever they were in for. And most of the clients put it on their credit cards. So we would take that credit card debt and we would work with the hospitals around the country and try to settle the debt, usually for about 50% of what they owe. And it was incredible. However, the rule was in debt settlement the total debt that they were enrolling could not exceed, the medical debt couldn't exceed more than 50% of their total debt, which means say they had a bill for $10,000 for the hospital and they had other bills of debt that was another $10,000, that's fine. But they couldn't come to us with just $50,000 worth of medical debt and us settle that whole $50,000. We could only settle about $25,000. So for a lot of people, it wasn't even worth it because they had so much medical debt that it just wasn't enough. And I will tell you, I dealt with, people who had cancer, couples where one of the spouses was dying soon and the debt was in both of their names. So the credit card maybe had over $100,000, but because the credit cards are in both of their names, even if the wife on her last days is dying, the husband is still going to be left with the debt. And so that they would try to work with us so that the spouse would not be left with that amount of debt on their own. It was just tragic.
Yeah.
But
and that's a mess. And I will tell you, here's me, an agent, you're an agent, and we train hundreds of agents all the time. And a lot of these insureds are coming with, I don't care. They'll write it off. They won't go after me. Well, no. Well, hospitals are suing. Tell us about that.
Right. So that's right. So and hospitals will sue. Credit card companies will sue. They will come after you. And the problem is if you wait till then and wait till you get the court order, it's too late to do anything. And that's what most people do. They don't think they need anything. They think it's going to be fine. They're going to be able to handle it. They're doing what they think they need to do at the time, right? We have no choice. We have to get this procedure done. And then think, okay, we'll, work extra, have the money. And then the bills just start piling up. And then they slowly cannot afford and they start drowning in debt. And that's where they're making the mistake. We also dealt, though, with dental. So things like implants, crowns. There are companies out there that will finance these bigger procedures for them and give them loans and credit cards at high interest rates. And they're thinking, yeah, that's fine. I'll just, do it that way and then pay it off slowly. And again, those bills just keep adding up and they can't do it. So the solution of just taking out some insurance before you need it, because that's what you have to do. If you wait till you need it, it's going to be too
Yes.
late. It's
That
too late.
is, I agree.
And
So here's what's happening, guys. I'm going to give you a quick little rundown. So they're getting this debt. And of course, I think these insureds are kind of thinking in the moment, yes, okay, maybe it gets settled. Maybe they get sued and it's just something that they need to collect. Well, looking at our industry, you get carriers that won't even work with you because they're going to do a background check. They're going to do a financial check on you. You got a bankruptcy. You're thinking a bankruptcy is going to wipe all this. Guys, you sometimes you can't find a job because of your debt, of your financial status. There's many ways that this could affect you. Now, we know, in fact, I found an article I'm going to share here with you guys. Check this out. So I was doing a little research, and this is from Kaiser. Many U.S. hospitals sue patients for debt or threaten their credit. So it's a real thing, guys. This was from December 21st, 2022. So this is real. Okay. And now we'll post this article in the description of this video so you guys can read it. So these hospitals are just not going to write off this deductible and this out of pocket that they're going to owe, that they owe the hospital. These hospitals are a business. They've got their own bills they got to pay. They've got to pay their doctors and their nurses and all the stuff in there. Well, I don't blame them. They need to collect the money. And then what ends up happening, Kim, is, all of us that are paying the bills, well, we have to pay more for those people who don't pay. Kind of, shifts the burden over to us, but still, in the grand scheme of things, not a good thing. So it is a very real thing that these guys are getting sued. Now, let's talk about, you mentioned that debt is relative. I could cough up a $5,000 bill. I may not want to, but I could. Okay. It's not going to wipe me out, but for some people, 5,000 is not even within their reach. So I did a little research and I just typed at Google, this thing is how many people can afford $1,000 emergency expense? And look at that. 57% of Americans cannot afford $1,000 expense. I mean, and that's crazy, guys. $1,000 expense. I mean, that means 43% could afford it. Okay. So as Kim was saying, it's a real problem. So let's talk about how this problem gets created. So Kim, here's what I did. I ran just a quote. So I'm just running a 35-year-old female making $15,000 a year, very low income individual. And I'm going to pull up this very first plan. Okay, for this individual. So we notice here that they have a $0 deductible and a $2,800 out of pocket. Okay, so in the grand scheme of things for us agents, what this means is that at the end of the day, if they've got a $100,000 bill at the hospital, they're going to pay $2,800. That's what they're going to owe them. Okay, now there's some other plans here. Let's only do silvers. There's some other plans here where it's you may be a $50 deductible with $1,000 out of pocket. So you got to find the right plan for your insured. But we're going to continue with this $2,800 one here. So they got to pay $2,800 at the end of the day. Well, if you got a $100,000 bill, $2,800 in my eyes, drop in the bucket. Okay, a friend of mine had open heart surgery a couple years ago. $400,000 bill. Okay. Now his out of pocket was about $9,000. He was like, okay, I wrote a check and he was done with it. But again, look, remember this number, guys, 57% can't even afford $1,000. Just imagine a $2,800 bill. I bet these numbers would get completely skewed to the negative side. So Kim, $2,800, that's a lot of money for people.
It is a lot of money. And again, you have to understand now the economy is even worse. So even those same people that may have been fine a year ago, with the economy, the price increases, the credit card interest rates going up, those same payments they were okay with, they're no longer okay with.
Yep. So here's the solution, guys. This is what you do. So how do you counter? You're talking to an insured, and they're like, I don't care. Okay, hey, well, I got a solution. Look, consider this. So this is what I tell my insureds, and I'm pretty successful at it. So I will tell the insured, look, you have a $0 deductible, but ultimately that's not your focus. This is a good thing, but this is your focus, $2,800. I've got a plan here that can do two things for you. Okay. And I love using Allstate Health Solutions, but you guys can use any indemnity product out there. There's a bunch of them. Now, I will start with this, that in some states, they don't allow this. Crazy California, okay? And there's some other states. You guys in California, your Department of Insurance does not allow for indemnity plans. So you guys are just, forget it. You all move on to something else. But in the rest of the states, this is what I would recommend. Okay. I like using the Plan Enhancer, and they have 3 versions of it. Okay, we'll go with the basic version. The Plan Enhancer AME, 2,500. What this means, AME stands for Accident Medical Expense. And if this person is involved in an accident, they will reimburse up to $2,500. Now, you do have some deductibles here you got to meet for year 1 and year 2, but the max benefit is $2,500. So I'm going to take care of $2,500 of that $2,800 if they're in an accident. Okay, not bad. If I want to completely indemnify them, and even they come out ahead with a little extra money, well, I could bump it up to $5,000. The price difference goes from $13 to $22. All right. Now, in this one scenario, I'm only talking about an accident, guys. What am I missing? Kim, what do you think I'm missing?
Sickness.
Sickness. Okay, that's another way you get into the hospital. So with this plan, I can upgrade the accident and add a sickness. So if they're admitted into the hospital due to a sickness, and they're in the hospital for 24 hours, it is not a day. They can't go in Monday night at 11 and get out Tuesday morning because they didn't hit the full 24 hours. So it's a 24-hour clock. If they hit the 24-hour clock, they hit the trigger and they get the benefit amount. Okay, no reimbursing. It's a straight up, they're going to write you a check. So if I upgrade from the accident to the accident plus the sickness, it goes up to $28. If I do the 5,000 with the sickness, it's $48. And that can go one step up where we can add cancer, heart attack, and stroke. I don't do that one very much. I kind of see it where I price myself out of it. But what I do a lot of is the accident with the sickness. And that's how we can help our insureds with this. They may not be able to afford $2,800, but they probably might be able to afford $28. Okay, now this is, when I ran these rates, this was for that same 35-year-old female, and it's just a household, it's just one person. The more people you add, the higher the premium is. But this is one good way for us agents to help our insureds with this crisis. And we're hearing straight from somebody who was involved in debt settlement and had to deal with this. Kim, what was the final outcome for some of these people who just, I guess it just ruins their credit?
It does ruin their credit temporarily. I mean, they go through a very big drop initially, because even if they were making credit card payments, they have to literally stop making those payments for several months. That creates the window for us to step in and say, something's wrong. We need to go in and get this debt settled because they can't afford it. But we did offer life-saving changes. So if their payment was maybe $1,000 a month, we could get it down to about $400 a month for them. So for them, there were a lot of tears. There was a lot of stress. But I did get a tremendous sense of satisfaction by helping these people. And it's unbelievable. And I know I've talked about this privately with you, but this is just one company. As one company that we work for, we were one of the largest in the nation. we enrolled between 10 and $15 million a day of debt for our clients. So just think about the state of the country, the economy, and it's not an easy call for people to make, and they don't want to. So you're offering them, and we're all offering them, an option to not get to that place by taking a little bit of insurance, getting everything covered. That small investment can make a tremendous difference, and you have to do it before something happens.
I agree. Before they get to you. So guys, for us agents, you know, it's on us to share this with our insureds. Look, you don't want it to be sudden. First of all, you don't want to incur the debt. It's not going to be a good thing. Could ruin your credit. They're not going to write it off. Okay. They're going to try to go after you. They're going to sue you. And then it's going to go to collections. And then there goes your credit way down the toilet. And it could or could not affect you down the road. Okay. But why don't we just take care of it all? Let me explain to you so you don't have to get to that point. So let's do your health insurance. And then here's a way that we can help you with that out of pocket. It's an easy solution. And then guess what? For us agents, we make money on the ACA plan. We make money on a dental and vision, because you mentioned that. Yes, they can go get care credit or whatever it is. You're right. It is a very high interest rate. They'll finance it. Oh, hell yeah. They'll do that in a heartbeat. But very, very high interest rate. Why not take out a dental plan? We can even start a dental plan tomorrow. They buy today, starts tomorrow. That easy. Okay. Now they're not going to reap the whole benefit of that plan until after a year, but at least it's something, it's better than nothing. So we make money on the ACA, we make money on a dental and vision, and then we make a little commission, a little more money on this indemnity plan, all by helping our insureds out. So guys, consider it. If you do not have an ACA, or if you do not have a contract for Allstate, get with me. I'm going to put my information down below. Send me an email. Okay. I'll have it down below. Send me an email and I will send you over the instructions on how to get contracted. If you're a new agent out there and you're thinking about, I'd love to get in this business to help people out, send me an email too. Okay. Respond down in the comments. I do reply to all the comments. Get down there and tell me that you'd like to get set up. And not only will we send you contracting, but we will train you guys, and then we will support you. So come and join us. There's a lot of opportunity in this market. The ship has not sailed an ACA yet, guys. Okay. A lot of agents are entering the market, but there's still plenty of room to grow and a ton of people that need our help. Kim, any final words for agents when they're dealing with insureds on this subject matter?
Just push the and the accident, because you're really doing them a favor. They're not thinking about the deductibles and the maximum out of pocket, but you showed a $2,800 example. A lot of times we see $5,000, $7,000, $8,000, $9,000. They don't have that money. The state of the economy that we're in right now, people need to take that little ounce of precaution to save them in the long term.
I completely agree with you. And with that, Kim, thank you so much for being on my today's training. And guys, don't forget, I need a couple of things. Number one is subscribe, like this video, post some comments. I respond to all the comments. And then subscribe to my channel, guys. I'm trying to have it grow. And then in the description, I got a bunch of goodies for you down there. I will put the link to these websites so that you so that you can use it as a reference when you're talking to your insureds. And I've got a bunch of goodies down there. I have my CRM. I have my ACA 101 course that you can buy. I have our Facebook ad course if you want information. All that's down in the description below. And again, guys, don't forget to subscribe. Thank you.